I was really lucky to be able to work in an area that you feel that you can make an important contribution, that you love and you feel for it. Because we were shrinking the dimension of electronics and photonics, and therefore we learned how to fabricate things smaller, we're coming to a dimension where we can interact with biology. That really excited me, and I started learning more and more about biology. I was fortunate to meet with Dr. Dennis Carson, who was the director at the time of the Moores Cancer Center, and he suggested that we start looking at nanotechnology for bringing some solutions to cancer. That really triggered a thought in my mind, a movie that I had seen when I was 10 years old, and I had seen this movie perhaps 10 times. The movie was Fantastic Voyage. It really captured my imagination because there was a ship full of people that was reduced in size and put inside a body to go and fight a stroke in the brain. When I brought this up with my collaborators at the Moores Cancer Center, they all loved the concept of this mothership. The question, of course, is how we will go about doing this. And the thought was we can use nanoparticles as capsules that will hold the therapeutic payload. I was fortunate to have one of my graduate students, Mike Benchimol, who is also an electrical engineer, that got interested in this area. Mike did contribute very significantly to the project.
This project is really interesting because we all know the serious problems with chemotherapy and how it causes all these side effects because you expose a patient to a drug that goes everywhere. So with this technology, we really have the power to deliver the drugs where we need it the most. Nanotechnology is typically referring to things that are about 1,000 times smaller than a human hair, much smaller than your own cells.
As we go smaller in the nanoscale dimensions, the cells are able to intake these nanoparticles, or essentially eat them. And that gives us an opportunity to address cancer cells because they have a tendency to eat much more than normal cells.
So recently, we've formed the company Sonergy. I'm working on a technology based on liposomes, and these are little nanocapsules to hold drugs or other agents. And liposomes are made of the same thing that your own cell membranes are made out of. Now the special thing about our drug carrier is that we can use focused ultrasound to open it up and cause the chemotherapy drugs to leak out. So if a patient has a tumor and you know exactly where it is, you can focus the ultrasound on that tumor and the drugs will be released in much higher concentrations where you focus the ultrasound.
The fact that we can improve the quality of life first, and then elongate life, and then maybe save lives, that's certainly something that is remarkable to be in that position.